Okay, I think we're ready. So, hi everyone. So this is Healthwatch Bury today, and we're doing our Facebook Live with Dr Gita Bhutani around how to deal with worry. So, I'm just going to do a quick introduction and go through our guidelines. Oh, get this onto an actual slideshow. Some of the guidelines that we have for our Facebook Lives are to be accepting. Everyone is welcome here, regardless of any race, ethnicity, national origin, religious affiliation, sexual orientation, sex, gender identity, or ability. And we need to respect each other's boundaries, so we don't want to make a comment. Try and put the questions that we have into the comment box, but we'd like you to just put those questions in once, please. That way we don't have to keep repeatedly sending the same comments and we don't miss anybody. We'd like you to not self-promote, please. We're not here for sales pitches. We need to stay focused on the comment of the stream. If something you have is relevant to the stream, please do write it. Otherwise, hold that back for another time, please. And we'd like to keep it clean. No shocking, obscene, vulgar or inflammatory language. We need to leave that out. So today we're going to go through the introduction that we're doing now with me, and then Dr. Gita is going to take over and give her presentation on how to deal with worry. Any questions that are put in the chat after that will then be answered for you. So a quick introduction to who Healthwatch is. Healthwatch is your health and social care champion. We make sure NHS leaders and other decision makers hear your voice and use your feedback to improve care. We listen to your experiences of using health and social care services, and we share them with those with the power to make change happen. We can also provide information and advice, and we do this by signposting to local or online support groups. We can offer information and advice about you or your family members' healthcare. We can listen to your experiences of using health and social care services within Bury as well, and that ties into how we feed things back. And there are our contact details. As you can see, we have our social media, Twitter, Facebook, YouTube, but that is our nice inbox and our phone number and our website should anybody want to get in touch. So I'll stop sharing my screen for a minute here. And it's down to you, Gita. Thank you very much.
Thanks, Charlotte. So hello, everyone. I'm just going to try and share my screen now. Right. And then get it to slideshow. Okay, so can everyone see those slides?
Yeah, that's brilliant. Thank you.
Okay, great. So hi, everyone. So I'm Gita Bhutani. I'm a clinical psychologist and have been for a very long time, nearly 30 years, which is kind of scary. My kind of day job is working in Lancashire and South Cumbria, and my clinical work is working with people with complex post-traumatic stress disorder. So some of what I'm going to tell you today is some of the work we use just to try and help people manage themselves. It's not specifically for people who have post-traumatic stress. It's actually really useful for anyone, whether you feel you've got difficulties or you don't feel you've got difficulties. So you might find it useful, you might find some things useful, you might find some things less useful. But let's see how we go. Okay, so I think the one thing I'm supposed to remember about stress and worry is they're normal emotions. You know, everyone feels stressed from time to time because life is like that. Life is not smooth. And I think stress generally indicates that there's something bothering us, whether it's the stress when you get up in the morning and think, oh, I've got to catch the bus, I'm going to be late. It helps us to some extent in terms of sort of gaining some momentum. And I think sometimes when we worry about things, you know, that can kind of focus our thinking, what's the problem? What is it that's bothering us? So if you've got a worry about, well, you know, I'm not sure what to do about this particular issue, whether it's about a family member or whether it's about a particular job or something you need to fix in the house, sometimes worrying about it or focusing on it can help you kind of come up with a solution. But I think one thing to remember is that it can be helpful, but sometimes worry and stress can feel overwhelming. And it's sometimes difficult to think, well, how do I actually manage that stress and worry so that it doesn't take over my life, so that I can kind of contain it in a space? And there's different ways we can manage that. It's not about ignoring a problem, because if you probably know that if you do ignore a problem, doesn't really go away. It usually comes and niggles you. Often, certainly 2 o'clock in the morning is a common time. So basically, if you think about when you are stressed, it can feel like, oh, I've got too much to do and I never get it all done. And sometimes people think, well, I just can't relax. And that physically can include having, say, frequent headaches, feeling tense. Your stomach can feel like it's sort of churning, or you've got butterflies, maybe feeling a bit sweaty or feeling a bit sick, or feeling emotionally wound up, feeling anxious, perhaps being impatient with people, or feeling that kind of feeling of dread that something awful is going to happen. And sometimes what we do in those situations is we can be snappy with ourselves. You spill the coffee on the worktop and you have a go at yourself, or someone else spills the coffee and you have a go at them. Maybe you eat more to help, maybe you eat less to help. Sometimes people feel a bit more withdrawn and they don't tend to kind of be forthcoming about how they feel, or avoid doing things or making silly mistakes. Everyone's different. We might all do some of these things, but we might all do just some of the things at some of the time. And I think the thinking bit's quite important, is that you can have racing thoughts thinking, what if about this? What if I don't get that done? What if that happens? What if that happens? And that can affect your concentration, because there's a little bit of your brain that's just kind of whirring around thinking about the thing that's really bugging you. And that can affect your concentration for perhaps other things that we kind of need to get on with during the day, and whether that's sorting out meals at home or doing chores or getting to work, that kind of thing. And sometimes it can lead to kind of expecting the worst that's going to happen. And that isn't always the case. So that's a bit of an outline in terms of how do I know I'm stressed. So now that we've figured that out, how can I actually manage this? So some of you will already know about this, and some of you will probably already use it. In terms of thinking about how you can manage physical symptoms, breathing exercises can be really, really useful. Because sometimes when we feel anxious, we tend to very much breathe from our chest. So we tend to kind of have quite shallow breathing, which can be a bit, quite sharp like that. Whereas actually, if you can kind of slow it down and imagine that you're pulling the breath into your stomach, and imagine that your stomach's going to sort of like come out as you breathe in and slowly as you breathe out, that can help you slow things down, and that can help you physically feel a bit better. Relaxation exercises are also useful, and there's loads of those around, around. And I think some of the resources we'll describe at the end can probably signpost you to some of that. But often relaxation exercises try and teach you the difference between feeling physically very tensed. So, I mean, the sort of the way I tend to show it to the people I see is you're sort of sitting here like this, your shoulders around your ears, and you just really, really tense up. And one of the things that relaxation exercises try and help you do is actually to teach you the difference between being tense and relaxed. So often they'll start off with, for example, suggesting you just tense up your hand for a moment, not too tight so that you actually find it painful, but just so that you notice that it's tight. And then you try and just let it go and let it relax a bit. I know I'm holding my arm up, but that's so that you can see it. And then you just let your fingers rest a little bit. And relaxation exercises can tell you all about that, and go through the different muscle groups in your body to try and help you learn the difference between being tense and relaxed. Like any kind of exercise, I suppose there's a little bit of learning involved, so that you learn the difference between being tense and relaxed. But the more you practice, the easier it is to think, are my shoulders around my ears? Do I just need to sit down and kind of just let everything, become a little bit less tense? We'll talk a little bit more about emotional techniques in terms of how people can soothe themselves, and maybe how we can kind of sort of slow things down a little bit, because worry and stress can be like that. It can feel that things are going really, really quickly. Today, we haven't got much time to sort of go into thinking, so we'll cover a sort of few quick tips. And I'm not really going to talk about the doing stuff, because there's loads and loads of sort of healthy living guides which are really helpful for this. There's things called Making Every Contact Count, which can tell you about sort of 5 ways to well-being in terms of how we can live our lives. Exercise is useful, healthy eating is useful, and you've probably heard that from other people, so I don't think I kind of need to repeat it. So moving on. why do we focus on emotional techniques? We're trying to get some breathing space. We're trying to help you pause so that to stop that constant churn of what am I going to do about this? What am I going to do about this? And what's going to happen about that? And when am I going to do that? And what's going to happen? And this is happening. And I don't know if the car's going to work and the bus is late and I'm not going to get to work. So it's about trying to just give you a bit of a pause to help you manage that a bit better. And those things can help reduce the feelings of stress because it can help you feel a bit more that I can manage this. I can manage how I feel about it. So, excuse me. So one example of this, now some of you might have thought about that. If you're sitting and you're thinking, well, I'm worrying about this, I'm worrying about that, maybe one of the ways to actually think about changing that a little bit is thinking about the 5, 4, 3, 2, 1 exercise. So sitting here where I am, what are 5 things you can see? Could it be a chair? To be fair, I can see a computer screen with 5, 4, 3, 2, 1 written in front of me, but I can see my glass of water. So, you know, that's one thing. Or it could be light patterns from a window. You can probably see, I'm not sure you can see anything behind me much. Or looking at a fabric pattern. Sometimes we've got fabric textures on chairs or the floor and the carpet. So just think, just see what can I notice that's around me? And then once you've done that, think, well, what are 4 things you can actually feel? So if you're sitting on a chair, that could be your feet on the floor. It could be the texture of your clothes. You know, can you notice how that feels? Could be your hand on the chair or my glass of water. So that there's, again, what's going on around you? What can you actually feel? You don't need to necessarily go out of your way in this, but it's actually just trying to draw your attention to what's back into the room with you. And then what are 3 things you can hear? Now, could be the noise of the traffic. I can hear that. Can't actually hear anyone talking, but I can probably hear a bit of a breeze somewhere. I can hear my computer sort of whirring slightly. But what else can you hear in where you are? Could be a whole range of things. Could be children playing, could be a dog barking, whole range of stuff. So once you've done that bit, what are 2 things you can smell? So could be perfume. You could have some fruit. I can't actually smell anything that much here. So, you know, put some perfume on this morning, but I think it's probably gone by now. But what else can you smell? And sometimes fabric smells, sometimes wooden furniture can smell. If you're outside, it could be all sorts of smells. You know, it could be petrol, could be the road, could be animals, could be trees, all sorts of things. But just try and see what you can actually notice. And then what's one thing you can taste? Sometimes it's helpful to think about what you can carry with you, or if you just brush your teeth, sometimes it's toothpaste. I think for me, you know, I had some fruit a while ago and I can kind of almost just taste it in you know, a little bit left in my mouth. So think about what you can actually taste. So that's one thing to try and remember to do. You can find examples of this all over the place. But if you think of going through this exercise, doing 5, 4, 3, 2, 1, it gives you some breathing space. You focus on something else. It just hopefully slows things down a little bit. So that's one way of doing it. The other thing that's really useful to do is thinking about an image of a safe place. Now, this is something that I've used a lot in clinical practice with people, but I've also used it. I used to do a lot of staff wellbeing sessions in the trust that I work for, and the staff found it really, really helpful. So, you know, we're all probably staff and patients in some context or another. So I think it's useful for all of us. And I think the important thing about a safe place image is it can be a place that you remember, or it can be an imaginary place. You know, you could have a picture on your wall, which you think that's where I want to be. That's where I feel really comfortable and safe. It's important it's just you and you're not interacting with other people. And the main reason for that is because relationships, interactions with other people have their own emotional characteristics. And while they can be good, sometimes they can't be good, sometimes they vary. So this is about you. People have asked me about whether it's helpful to have pets in there, and it can be, but I think that's a bit of an informed choice for people because, you know, most pets don't live as long as humans do. And if you've got a memory of a pet that perhaps is no longer with you, it can make you feel a bit sad. Whereas this isn't about doing that. This is about trying to feel safe and comfortable and relaxed. So that's why we suggest it's just you. If it's an animal that has passed away a long time ago and it gives you comfortable memories, then, you know, it's your choice. And I think there's something about the safe place imagery, which means you need to take the time to build it up. So if you think about the 5, 4, 3, 2, 1 thing that we just talked about, when you think about your safe place image, think about, well, what can you see? What's your 360-degree view? If you turn around, what can you see around you? What does it sound like? What does it feel like? You know, what would you like it to look like? And we've got some questions on the next slide, which are just a bit of a reminder of that. And what are you doing in that? And I guess just trying to do all these different things. So what we've often found doing this safe place exercise is lots of people use beaches, though there are people that think, well, I'm never going to use that because I hate the feel of sand in between my toes. Doesn't have to be a beach. People have suggested being in the hillside, going for a walk, sitting inside a tent. Often water features, but it doesn't have to. If you hate water, then it's not going to be your safe place. Sometimes people said, well, you know, I'm doing the garden, I'm on my own, and it's just nice pottering there. So it could be that. It could be lying on a beach. It could be going for a walk. It could be pottering around the garden. I think someone said whitewater rafting once. It can be anything you like, as long as it's something that helps you feel comfortable and safe. And then, as I mentioned, what does it look, smell, sound, or feel like? And then the other thing that I think that's really important is, how do you feel in that? When you take yourself to that safe place and you remind yourself that, you know, lying on that beach on holiday or going for that walk in that park, how did it feel? And where do you notice that feeling? Because often we're really good at noticing when we feel uncomfortable, partly because it's a valuable thing to do in terms of keeping us safe, but we'll probably pay less attention often to how we feel when we are feeling safe and comfortable. So, you know, how's your stomach feeling? How's your breathing? You know, how do your joints feel? And what's that feeling like? So the purpose of doing it all in that way is actually to build up this really, really sort of, I don't know what you call it, 360-degree, 4-dimensional image, so that you can almost think yourself into it. And I think one of the things that's important is to actually try and practice it. You know, spend 5 minutes, 10 minutes a day just trying to think yourself into that safe place. And the reason for practicing it is so that when you think, oh, I could really do with doing that, I'm going to go, you know, I've called it my garden, for example. I'm going to go and sit in my garden image. You can get it really quickly. You know, you're not having to kind of think, well, what was it like? What was it like? You've just practiced this image. So you've almost like got it like a photograph in your mind, but ideally like I don't know what a 3-dimensional or 4-dimensional photograph would look like, but you can almost think yourself in there. So that's well worth practicing as well. And what if you can do that and take yourself in there, that minute or two that you spend in that place just perhaps breaks the pattern of your thoughts worrying, and then you can go back to them and it perhaps doesn't feel quite so overwhelming. So the next one that I was going to mention is using textures. So when I said earlier about the sort of 5, 4, 3, 2, 1, one of the things was actually, what can you feel? And everyone's different in this one. Sometimes perhaps feeling a bit of cloth, you know, a tea towel, having that, or a handkerchief, if anyone has those sort of things these days, or even just a bit of cloth, which you know you can feel and think, that I know that I can stroke that, I can sense what kind of texture it's actually like, or something that's maybe a bit furry or fluffy. And I had a conversation with with someone a while ago, and they said that they liked the idea of using something furry, and what they'd found was you can get kind of comfort insoles which feel slightly furry, so they use something like that. Doesn't have to be anything too fancy. And someone else said, well, if I have a stone in my pocket, you know, a smooth stone or a slightly rough stone, some sort of pebble, then it's again something different to kind of feel and focus on. So all sorts of things. I'm sure there's more than that. It's your choice. I'm sure it's really, really inventive. I think someone else suggested, just even touching the keys in the pocket. I mean, the main thing is it's something that's not going to cause pain or, hurt you in any way. It's something that you can actually use that's helpful. It could be a cork, it could be perhaps a bit of wood, as long as it's smooth. So all sorts of things. And if it's small enough, it's something you can keep in a bag or keep in your pocket. And then again, if things feel a bit much, you can think, I'm just going to focus on what this stone feels like in my pocket. You don't have to write Healthwatch Bury on it, but maybe that's something we can think about for the future as a resource. So that's one thing. And then just picking up on smells. So what kind of smell can help you feel better? Someone I spoke to again a while ago really, said lavender smells. You can dry lavender, you can get lavender, those kind of things are really useful. Some people absolutely hate it. Someone said to me grass. They actually found a perfume, and I'm afraid I don't remember which one it was, that sort of felt very grassy to them. So they could actually put a bit on a piece of cloth and keep it in their pocket. So again, all sorts of things. What kind of smell would be helpful in terms of helping you feel better? So all those things can be useful. Not sure what other smells, but again, I'm perhaps not the best smell expert. Some of you will probably have better approaches to that. So we very much sort of run through very, very quickly, I'm just seeing what's coming next, of what can be useful in terms of this. And I think the main thing to actually sort of remember is put together your own toolkit, because what we found, and what I've certainly found in terms of working with people, not everything works every single time. Sometimes if things are feeling that challenging or that stressful, just thinking about what's the thing that can help you shift away from the kind of your thoughts worrying and the feeling of dread and the breathing going. Now, it could just be stroking that stone in your pocket. It could be getting the piece of cloth with the smell out so that you can have a bit of a sniff at it, or it could be keeping whatever it is in your pocket that you can add as a taste, mints, anything like that. But maybe just having a think about what you could keep with you that would be helpful, that you think, yes, oh, it's all getting a bit much, I'm just going to do that. And then, if you can then do something that's perhaps a bit longer, if it's not that bad, and you think, I just need some headspace, I need to stop doing this, it doesn't feel quite so overwhelming, then it can be easier to go to the 5, 4, 3, 2, 1 or to the safe place imagery, because they're kind of slightly more complicated tasks. Stroking a stone is not necessarily a complicated task. So think about what your toolkit would look like to help you deal with stress, and what you could think about carrying around with you. It can be small, it can be big, and what you keep in your head in terms of 5, 4, 3, 2, 1, or the safe place image, that kind of thing. So I hope that's been helpful in terms of just outlining some different things that you can try. We've got some other wellbeing resources. So I'm not sure whether I get to hand back to Charlotte at this point to talk about what's actually available in Bury. But we've got all the resources on the screen. Charlotte, I don't know if you want to say anything more about these, or would just let people have a look at them.
Yeah, well, there's quite a few services there. Thank you for that, by the way, Gita. That was really good presentation there. The best advice I can give, rather than us go through all of them, is to get in touch with Healthwatch Bury, either by our Facebook, you can phone us, get in touch with us via email, and we can listen to your situation and pass you to the best service that would be available for your needs at that time. Obviously, young people need different mental health services than adults need, etc., etc. So, and it depends on the severity as well, because obviously we've got the urgent emergency care by appointment, we've got access and crisis service there that will work differently to Healthy Young Minds or Healthy Minds or CAMS. So sorry, it's not Healthy Young Minds anymore. But yeah, that's brilliant. Thank you.
I think we've got some more on the next slide as well, haven't we? So So again, I think they'll all be available, I think, on the Healthwatch website, but lots and lots of different things in terms of looking for different ways of trying to find help. So I'll just leave it on for a minute or two, just for people to have a quick look.
We actually had Andy's Man's Club on one of our Facebook Lives a couple of weeks ago, and it's some really great support that they've got going on at the moment. It's amazing.
Yeah, it's great. I mean, the sort of men's sheds and the man's clubs have been really, really helpful, because I think, I mean, not every man's like this, but I think sometimes men have found it difficult to kind of, get support and go to groups in the way that women sometimes do. And I think sometimes the kind of peer support in terms of actually focusing around specific activities or the kind of men's clubs is been really, really helpful. But there is probably something out there for most people. It's not always that easy to find.
No, exactly. And some of them are very specialised, like the BAME project, for example, when it deals with minorities. And I think they are facing struggles that maybe the collective don't generally deal with. So it's nice that there's more specific support available.
Yeah. So I think then there's the next one. So yeah, more resources as well. And I think finally, it's a bit of a reminder about Healthwatch Bury. And I think what Charlotte started with in terms of where Healthwatch Bury is, website, phone number, email, tweets, Facebook, where we are today. So I think that's it for the slideshow. So what I'm going to do is try and exit. Oh, stop sharing. There we go. Done it. Right.
Oh, thank you so much for that, Gita. That was amazing. There's obviously a lot of effort has gone into that PowerPoint. Thank you so much. Do we have any questions at all, Anna Marie? Let me just see if we got the chat.
No questions on Facebook. I'm not sure whether any of the participants would have any questions.
No, I don't think so then. Okay, so I just want to reiterate again before we close the session that it's not a now or never as far as your questions go. Do put them in the comment section of the chat. Even if you're watching this on replay or you're watching this on YouTube, we will do our best to answer them. If we can't answer them, we'll get in touch with Gita and hopefully she will be able to answer them for us. But thank you so much for your time today, Gita. That's been a really, really worthwhile. Lots of information really, and lots of techniques and tactics that can be used on people. And we all deal with worry at some point in our lives, don't we? Absolutely. So that's really helpful. Thank you so much for your time and effort there. That was brilliant.
Very welcome. Thank you.
Thank you. Right, so if there's nothing more there, then we'll end this live. And again, if anybody has any questions, please put them in the comments. Oh, sorry, did you say something, Ruth?
Oh, hiya. Yeah, I was just wondering, somebody was asking me about, for example, women who or men even who've experienced trauma, and I know that obviously that might be quite specific, and I think somebody answered to say they might find out and put it on the website, but I didn't know whether Gita had any thoughts about that in terms of people who might be wanting to deal with things that they've experienced earlier in life, and whether there are any support routes for that at all.
Okay, so I think that I suppose there's probably several components to this. The first is the techniques around sort of managing emotions can apply to everyone, including people that are perhaps experiencing traumatic stress symptoms, which can include sort of memories that are really intrusive or feeling like you're experiencing the thing that happened in the past. So using those techniques can help. They can be hard because sometimes the things that happened in the past can feel like they're in the present and can feel quite overwhelming. I think there's a range of actually ways of seeking help. There are a number of support groups around in terms of whether for perhaps women who've experienced abuse either in adulthood or childhood, and there's different peer support groups in that way. The Freedom from Torture, which has got a branch in Manchester, background noise, sorry. As I've got a branch in Manchester, has
There are a
also
few support groups for PTSD as well, isn't there, and for veterans and things like that, especially around the Bury area. There are quite a few different groups that meet.
Yeah, and then more specialist help. The Healthy Minds, the Improving Access to Psychological Therapy Services, will also offer help for people who experience post-traumatic stress symptoms. Through their services, people can be referred on to specialist services. I think the challenge for specialist services and for people wanting to access them is, sadly, we've got long waiting lists, and that's probably true in a range of areas. But there are still a range of things out there that can help. They may not be the full solution, but they can still do a lot of things in the meantime. So.
That's great. I think I wasn't sure around signposting whether Bury involvement group big is the thing, or whether there are any groups for women who might want to meet on a woman only basis. As you say, perhaps for dealing with past issues or what have you. So maybe it is something we could look into and put on the website.
There is actually a really, really good group that we've been working with, Ruth, now that you mention it, called Women of Worth, or WOW, and that's for supporting ladies that have been through different types of trauma. If they want a female-only group, it's a very safe sort of place for them. But big as well, like you were saying, they are fabulous as well with mental health support. So I think it depends on what you're facing and the type of support that will be best for you and make you feel the most comfortable. So the best advice we can give is just get in touch with us so we can talk to you about your options and the best way that you would like to move forward, because it does have to be on the terms of the person that's seeking the help, really, and what they'd prefer. Because you do make a very good point, obviously, about ladies just wanting a ladies only group, for example, because sometimes that's the only way that you're going to feel safe in certain situations, or comfortable, not even safe, just comfortable. So yeah.
Thanks, Charlotte, that's really helpful.
If that's everything, guys, I want to thank everybody who's come on board today. Thanks again, Gita, for that presentation. It was beautiful, and we'll look forward to seeing everybody on the next live, hopefully. Thank you very much.
Thank you.